Representative Exum now. Would you care to mark further on House Bill 5001 as amended, Madam?
Thank you, Mr. Speaker. I want to tell you why this bill is important. Among our youth, we've seen increasing cases of anxiety, depression, suicide and suicidal ideation, eating disorders. Children lined up in emergency rooms where they can remain for an average of 5 days before the next level of care is available. Lengthy waiting lists due to the shortage of providers, programs, and/or services. While there were mental health issues prior to the pandemic, the issues have been exacerbated and the gaps have been highlighted as a result. Mr. Speaker, under your direction, we have been working as a bipartisan working group since November. We've spent countless hours working and fine-tuning this piece of legislation. I'd like to thank the good chairwoman of the Children's Committee, the chairman and the ranking chair of the Public Health Committee, and the good representative of the 53rd District, as well as others from both sides of the aisle and from both chambers. Together, we have created what has been called by Connecticut Children's Medical Center the most transformative piece of children's mental health legislation in decades. At this point, I will summarize the bill.
Madam, you may proceed.
Sections 1 through 6, licensure waivers and reciprocity for mental health professionals for the purpose of quickly expanding our provider access. Section 7 through 8 adds appointments to existing Children's Mental, Emotional, and Behavioral Health Plan Implementation Advisory Board. Section 9, intensive outpatient programs for youth. Section 10, help our pediatricians and patients to expanding access mental health. Section 11, brings into OHA a dedicated person to work on denials and advocacy for minor patients. Sections 13 through 15 work to hire mental health professionals in K through 12 schools and college and summer programs. Sections 16 through 21 deal with the effective trauma response and crisis intervention model. Sections 22 through 30, implementation of the new 988 suicide hotline. Section 31 allows extra beds in existing facilities. Section 32, grant programs for prescriptions, evidence-based programs, and ICAPs for those with private insurance and the uninsured. Section 33, screening tool to aid pediatricians. Sections 34 through 36 creates a state version of mental health first aid, which is optional but available to assist school districts. Section 37 opens respite to those with private insurance and uninsured, already in place for those with Husky. Section 38, recruitment, retention of prescribers into our state. Section 39, allow DCF and DEMAS to advertise mental health-related programs and services. Sections 40 through 42 helps adults through peer-to-peer training and allows yearly wellness exams. Sections 43 through 46 support the new DCF urgent care crisis centers to effectively serve children and help reduce emergency department visits. Sections 47 through 48 develop a collaborative care model. Sections 55 through 56 require no prior authorization for inpatient treatment. Sections 57, payment parity study. Sections 60 through 61 fully funds programs for teens. Section 62 through 66 pertains to the Office of Victim Services and ensures that abused children and children of trauma have access to behavioral health support. Section 69 provide pediatrician training for better mental health responses for their patients. Section 70 establishes a behavioral health oversight committee, and Section 71 through 73 creates consumer awareness about the Office of the Healthcare Advocate. This is not a feel-good bill. This is a bill that can literally save lives. It addresses the urgency of now, and it addresses the immediate, the intermediate, and the long-term needs of our children, their families, the communities, the providers in our state. With that, Mr. Speaker, I move for adoption.